A stroke, which is also known as cerebral vascular accident or brain attack, takes place when the supply of blood to the brain is disrupted, which results in damage to the brain, cells or tissue. The blood flow can be disrupted either due to an obstruction in the artery or rupture of blood vessels. In India, strokes are among the leading cause of disability and death, with 18 lakh stroke cases reported every year, as per the Indian Stroke Association. So essentially there are two types of strokes. One is the ischemic stroke and the other is the hemorrhagic stroke. Some people also consider a third category, which is essentially a kind of ischemic stroke, which is the transient ischemic attack. So in the ischemic stroke, what happens is that the blood supply to the brain is blocked due to a clot or a plaque in the artery. And this is the most common type of stroke. And the other hemorrhagic stroke, of which there is about 20% or so. In this case, the blood vessel bursts or is ruptured, which leads to bleeding within the brain or in the space between the brain and the membrane. I think it's much easier to prevent the stroke than to have it treated, because stroke is something that requires immediate medical attention. And if that is not provided, then it leads to a very long-term treatment and rehabilitation. So prevention is definitely the better idea, and it can very easily be done by maintaining or changing your lifestyle. Within the diagnosis, there are several tests that are conducted to find out where the problem occurs, and this can be blood tests first of all, and then all the scans or the imaging. So it will be CT scan and MRI. So CT scan is typically 1500 to 3500 for a brain scan. Then MRI would be about averaging 5,000 or 2,000 to 7,000, depending on where you get it from. And then is angiography, which is much costlier, which would be about 10,000 or so. So the treatment cost would depend on what kind of stroke you had, how extensive the damage is, and where you're getting it treated from. So we'll consider a private hospital in Delhi where you're getting your treatment. So within that, first let us consider the transient ischemic attack. In this case, in every kind of stroke, the kind of treatment will determine the cost. So within the first one, which is the transient one, it can be treated either through medication or through angioplasty. So what we are essentially doing in case of treatment, medication treatment, is we are providing blood thinners to dissolve the clots, because this is caused mainly because of the clots. And medication is not very expensive, 1,000 to 3,000. But if you're getting an angioplasty done, which means that a stent will be put inside your blood vessel to remove the clot. This will be more expensive, about 2 to 3 lakh. Then we come to the ischemic stroke. Here we are considering the acute ischemic stroke, which means that there is a clot which is not dissolving. In case of TCA, the first case, typically the clot it occurs and then it is a temporary state. So it can dissolve on its own, or it requires thinners or smaller treatment. But in case of an acute ischemic stroke, you will require more extensive treatment. There are two ways in which you can get it treated. One would be drugs, which are called the thrombolytic drugs, and the other is the mechanical thrombectomy. Now, thrombolytic drugs, these are not like blood thinners, they are much more strong to dissolve the tougher clots. And these would cost from anywhere from 40,000 to 80,000. And then comes the mechanical thrombectomy, which is being adopted across the world as the preferred form of treating this. But in India, it is not very common. And this costs much more. It costs about 2 to 7 lakh. In this case, in the mechanical thrombectomy, what is done is a stent retriever. It is put inside the blood vessel and the clot is removed mechanically. So it is a more expensive treatment, and it will also require some hospital stay, which will increase your costs. Then finally we come to the hemorrhagic stroke. So hemorrhagic stroke, as I mentioned earlier, it's caused because of the bleeding. Now the bleeding can happen for various reasons. The blood vessel can rupture, or it can be damaged because of pressure. So again, the cost of treatment will depend on the course that is taken. So let us consider, now there are various ways in which this rupture happens. Mostly it is because of high blood pressure, and the second reason is aneurysms. Now while blood pressure can be managed in ways that you improve your lifestyle, you do not smoke, you do not have bad food habits, but aneurysm is something that typically you can't control. With aneurysms, what happens is that the blood vessel becomes enlarged and then ruptures. Now this can happen for various reasons, but we'll just deal with the basics here. The first one is due to high blood pressure. In this case, typically this happens with small blood vessels. So the damage is not too extensive, and it can be treated through drugs, medication, or you may require a surgery, but it is not a very extensive surgery. And typically the damage, the repair of the blood vessel is not too extensive, the bleeding is minor. So the surgery will again cost about 2 to 3 lakh, and the medication is 1,000 to 3,000. Now the next is the bleeding that happens due to aneurysms. So what happens here is that you can treat it through two ways, which is surgery, or the other method is the intervention method. Surgery has a high risk factor. Your costs will increase because your hospital stay will increase. You might require an ICU treatment, so the costs are heavy. But the second treatment, which is through the intervention, which is called coiling, it is also expensive, but it is a much safer one, may require lesser stay. So in the intervention method, which is called coiling, what happens is you insert a catheter and then you place some platinum coils in the area where the damage is done, and then you seal it. And this is expensive. It will cost you anywhere between 3 to 10 lakh because of the whatever devices that you use to. So in strokes, rehabilitation does play a big role, because what happens is, in most cases, the treatment is not immediate. The medical treatment that is required in strokes has to be immediate. If it is not, then the damage is extensive. And if the damage happens to the brain cells or tissue, then this damage will require a lot of long-term rehabilitation. Depending on the damage, it can be short-term, but it can extend to several months or a year, or it can even require lifetime care. Within rehabilitation, you will require nursing care, medical care, you will require physiotherapy, a very essential part of rehabilitation. So let's consider the nursing cost. Nursing cost, if you get a cheaper one, you may have to pay less. But if you get better nursing care or medical care, that can easily cost you 50,000 to a lakh for a month. Then physiotherapy can be cheaper, 10,000 to 30,000, relatively cheaper, 10,000 to 30,000 a month. Medication may also be required, which is not a very huge cost. But if you get admitted to a rehab center, that will be about anywhere between 5 to 10,000 a day. So it is an expensive treatment, and as Dr. Vipul Gupta has said from Artemis Gurugram, that 1 in 4 person is likely to get a stroke in his lifetime in India. So it is very important to be prepared. You either improve your lifestyle, or you be financially prepared to deal with all the costs that have been mentioned here.